In the professional career of an obstetrician or midwife, there is no more tragic event than a maternal death. Most obstetricians in developed countries are fortunate enough to end their professional career without having to witness this tragedy. For those in developing countries, maternal mortality is not just words or numbers, it is women who have names. And when it comes to Uganda, we lose 336 mothers per 100,000 live births. Whereas it is estimated that over the past 20 years, maternal mortality rates have fallen by only 20%, experts say the remaining stifling figures are as a result of issues that we have ignored. Dr. Simon Tomsange, an obstetrician and gynecologist with Span Medicare, says the figures are amplified by the high rate of teenage pregnancies.
Most of the complications talked about in documented in pregnancy are at the extremes of the age ranges. Early versus late. So every time someone gets pregnant early, they can feel, you call it obstructed labor. And when they get pregnant, some are not financially stable, some want to deal with the pregnancy stealthily. So all those things can predispose them to a complication that can lead to death.
He adds that 3 major causes of maternal deaths are preventable, but lack of resources continues to hinder the efforts to save mothers' lives. These include hemorrhage, obstructed labor, and complications from abortion.
Abortions are ranked 3rd in causing mortality among these mothers. We still find mothers being referred from crossing districts to go and get the due attention they deserve, like crossing Jinja to go to Kampala as a referral.
Uganda is currently constrained by a shortage of health workers. It is estimated that about 5,000 babies are born every day. By June 2017, Uganda had only 211 obstetrics and gynecology experts, meaning other factors remaining constant, they would still not be enough to deal with the 366 mothers that die due to lack of special attention while giving birth.
Kampala alone has more specialist doctors than the rest of Uganda. There's so many districts. So what does that show? That all these people are concentrated in the place where they are. There are funds, okay, people who can pay for the services. But if the government can try to come in, recruit them, facilitate them well, put them to these different centers so that there are no delays. A mother should not be taken from one district to another to seek specialized help.
In its intervention, the government recently opened up a specialized hospital for women and neonates in Mulago.
Charges were arrived at after examining the cost of similar services within the country and, where possible, a comparison with similar services abroad. Patients will pay a consultation fee of 50,000 Uganda shillings. Admitted patients will pay 80,000 shillings per day.
But Dr. Tomsange says this hospital will only work if it's maintained for referral cases.
That's why I would prefer people cost sharing than it being free. So that if people are cost sharing, let me say, but the charges recently published in the papers are too high, in my opinion. They should actually be cut by 3/4.
This hospital is meant to become a center of excellence which will also facilitate training more specialists. However, Dr. Tomsange says this will not solve immediate problems like the shortage of midwives by close to 3,000 people.
Why? Because the lower centers are suffocating the higher centers. A lot of time is wasted at the national referral, seeing cases that should have been seen from Chisenyi Health Center 4. Why? Because Chisenyi will refer a client who needs a Caesar to Mulago.
Implementing maternal health programs like the essential training in operative obstetrics at scale will avert an additional 57,600 maternal and newborn death and will translate into reductions in maternal mortality rates. Walter Mwesije, NTV.